Okay, there must be some questions out there. There's a lot of material, so yes, Dr. Jang.
Well, on the first part of the KRAS G12C, I want to ask you a couple of questions. Number one is we know KRAS G12C is not created equal compared to ALK and EGFR. Based on the presentation you show, do you use KRAS G12C like sotorasib or as a frontline therapy? That's number one. Number two is we know the ALK and EGFR, if a patient has brain mets, you could forego with stereotactic radiation and just go with the TKIs. But in KRAS G12C, I don't think it's there yet. I mean, do you agree? That's number one question. Number two question is, I want you to comment a little bit about the dosing of the sotorasib and adagrasib. I believe the FDA had currently asked a company to readdress that. Now, if they adjust the medication, the dosing, without affecting the outcome.
Thank you for the questions. I think they're all very excellent questions. So for G12C inhibitors, sotorasib was approved post-systemic therapy. So right now, the approval is not for first-line use. That being said, have I considered patients who I thought like PS was borderline to consider platinum-based chemotherapy to use G12C inhibitor up front? Sure. So I think it is a case-by-case scenario. But currently, the FDA recommendation is not for first-line use. The second question revolves around the CNS penetration of these drugs, and I agree with you. For sotorasib, perhaps the data on CNS is very limited. Perhaps we should be very careful about treating patients with such inhibitors when the CNS penetration data is limited. And although I saw that adagrasib has a somewhat more of a promising CNS penetration data, right now I would worry a little bit about using G12C inhibitors to